think the problem is most of the viewers on this platform probably will not have access to you because they don't live in Michigan, right? So the question is, how do they send pictures to their own dermatologist, right? And maybe you can walk us through, because you've seen lots of pictures and lots of bad pictures are taken by the iPhone or Samsung phones. Like, what are what do you need to see, and what do you ideally want to see images from the patients, like from the lighting, from like different perspectives, so that the purpose of my asking those questions is so that when whoever's watching this, when they're interacting with their own physicians, and they can do a better job, so their own physician can help them in making the diagnosis.
So it's kind of a guidance for the patients, right? Like, how do they take clinically helpful photographs? That's what I call them. I don't say it's the best. We're not publishing textbooks here. We are trying to help them to come up with clinical helpful photographs, which can kind of make us diagnose things. So the first thing is exposure, as you said. So ideally it should be a daylight. A full spectrum bulb can be used. If the outdoor lighting is the best, one should avoid shadows in the photos. If they have a macro option on their phone, use the macro option when they are taking photo of the single lesion. Make sure the photos are not blurry, and take photos kind of perpendicular to the lesions or the rashes, which needs to be evaluated. Kind of minimize the background noise. Like, for example, try to kind of have a neutral background, which the best colors would be like gray, dark blue. Use a solid neutral color. Avoid distractors. Take several views. Choose which is the best and send the best ones to your doctor. Zoom in to show the details, and zoom out to show the location. So these are some important things which you should be.
When you say zoom in, zoom out, I mean, are you basically like you hold? Let's say I'm using an iPhone, right? And you don't want people to put on you want people to put on the portrait view model or not a portrait view?
No, it's just the regular mode.
Okay. Just the regular model. So I'm putting out my phone. Just you ask him to put on the regular photo mode, not the portrait mode. Just take the regular photo mode. And when you say zoom in, zoom out, are you moving this camera in and out, or you using your fingers to digitally zoom in, zoom out?
You're using your fingers to digitally zoom in and zoom out, because going too close to the image, you might lose the clarity of the image when you're not in focus.
Okay. And then does it help to take like far away pictures so people know like approximately where it is, and then getting really close? And so you want like a far away picture for a clinical overview. So as a clinician, you know where it is, but then you also want a close-up image of the lesion. Ideally, you can zoom in and get into the size. But once you zoom in as a clinician, how do you know the size of this lesion? Do you want them to put some sort of ruler right next to it or anything?
That would be great if they can put a ruler next to it. Yeah, when we take when we get the photos from our nurses, they do put a ruler next to the lesion. Just kind of gives us a reference, if that is possible. But if we expect all our patients to have a ruler, that's the only issue there. Yeah, I agree with you. So the order in which we would want these photos to be sent is like, the first is the what we call as the forest view or the overall view.
Sure.
And then what we call as the macro view, which is the close-up view. In the overall view, it tells you the anatomical site and tells you which part of the body it is located. Try to involve like take a photo which has a good anatomy. Like, let's say if you are taking a photo of your left arm, just make sure that you have the elbow in place in the picture, so that you know where it is, proximal, distal, and things like that, which helps your dermatologist. And after that, yes, zoom in to kind of take the photographs.
And when you zoom in, let's say if you try to, I mean, obviously you can use this like photo mode, and you can basically look at like how far away you can capture the whole thing. but if you want to take the macro, meaning the close-up picture of that particular lesion of interest, how close should the camera be? Like a
Yes.
12-inch, 18-inch, 6-inch?
Right. So it should be around 2 inches from the lesion. So within the 2 inches is what you call it as the macro by definition. So you can take within the 2 inches of it and try to see if it helps the focus of it, and you get the macro image at that. And then after macro, we normally, if the patients can afford this kind of dermoscopy attachments which are available out there in the market, they could attach that to the phone and then take a photograph by placing the faceplate of the dermatoscope on the lesion, make sure the dermatoscope is on, and then take the image.
Yeah, those things are really helpful. I mean, I think it become like during COVID, a lot of our patients couldn't come into the clinic, and so they actually went out and bought some of those small dermoscopy attachment and then clipped onto the phone and then took the pictures. And one more thing, when you take the dermoscopy photo, for those out there who's really passionate about doing this, right? And do you ask him to spray alcohol or something over the side? Do you get the lesion wet, or you,
Right.
you don't need to?
Actually, it does matter. It's very important to kind of wipe the lesion with alcohol. So when I teach my nurses how to take clinically helpful photographs, that's the important step which I tell them to like take an alcohol pad, wipe the lesion before you place the faceplate of the dermatoscope before you take the photographs. It actually helps a lot. Means the reason why I do that is because if there are too much scale, which is not visible through the naked eye, the light can kind of reflect back from those scales, and you would not be able to see that dermoscopy image very clearly. So when you take those scales off, it actually helps visualization of deeper structure really well.
Yeah, and I think this is one of the things, the caveat, the subtlety about dermoscopy, because you allow us to see structures underneath the skin that you cannot see with just a naked eye exam. And it has to do with optics. That is, you have to put a little bit of like fluid on top that allows the light to penetrate deeper, penetrate the first layer of skin, get down to the layer of skin when the light bounces back, and that's what we see. So it's not only just like, to me, like I tell my staff, like not only to wipe it up, I actually like have a spray that spray a little bit of alcohol on it. The surface have to be a little bit wet and with fluid on it, and allow you to sort of take a better pictures. So just to summarize, right, for people who are taking pictures, that is, one, you want to stay far away a little bit, and that's the first shot. And because of that, you get a global view, and so you know where it is. And also it gives you an idea about this person because you can see the sun damage, how many moles you have. It gives you some sort of other clues about just that patient's risk level, in a sense. And then you get really up to close, about 2 inches, and then you take a close-up photos. And then sometimes you want to even zoom, digitally zoom, and to take the pictures. But ideally, if there's a ruler right there, so people will know, as you know, the physician can see like how far, how big that lesion really is. And then lastly, if someone went out and bought a dermoscopy attachment, you want to spray with alcohol and then take the pictures, basically.